Thank you all for coming. I'm so excited to introduce our speaker today and to welcome you to the first of a series of seminars called Aging is Public Health. I am Hannah Hoffman. I've been posting lots of things and trying to get you all interested in coming here. I'm a PhD candidate in the Global Community Health and Behavioral Sciences Department. My focus is access to care for older adults. And so there aren't many people talking about aging in the School of Public Health, and I think that needs to change, and hopefully this will get people thinking about it. And I'm really excited to see some faces that I don't know, and faces from the community as well, so welcome. I will introduce our speaker today. This is Deborah Jackson. She is a returning native to New Orleans, and an award-winning professional inspirational speaker, a caregiver, author, pastoral care leader, and jewelry designer. She's the founder and executive director of Healed 3D, which you'll hear more about today, the Caregivers Flourishing Foundation, and the National Alzheimer's Triple E Summit, and you'll hear about that as well. Deborah is a diverse educator equipped with 20 years of business leadership experience in organizations like Merck and Johnson & Johnson, theological and biblical studies, entrepreneurship, and Alzheimer's and related dementia, caregiving, and disease knowledge. Additionally, Deborah spent 20 years in a professional tennis career, playing #1 division tennis at the University of New Orleans, which I feel like I need to know more about as well. With Deborah's vast personal and professional experiences, her most meaningful, life-changing, impactful role is now and will forever be her 8 years now, more? 9 years as an Alzheimer's caregiver to her mother. So with that, I'd like to welcome Deborah.
Thank you. It's so good to see all of you come out, because aging is not, as Hannah said, it's just not a subject that we tend to do well talking about in this country. And specifically, I'm going to focus on one area, which is dementia. And then we're going to drill down more specifically to Alzheimer's, which has been a part of my 9 years of experience. So let's start with a little quiz, because I want to see how much you guys already know, or may think you know, about either dementia or Alzheimer's. So are you ready? And their prizes. So just kind of, who's got our little prizes?
Caregiver over here.
Okay, so let me get to it. All right, so the first question, first person that thinks they know the answer, just raise your hand. Alzheimer's is different than dementia, true or false?
So, I understand, dementia is sort of a broad umbrella, Alzheimer's is like a type of dementia.
There you go. So, ding, ding, ding. So good. That's good. We have to have a baseline, right? We have to kind of know where we are. Okay. Next question, true or false? Alzheimer's is primarily an old person's disease.
False.
Okay, well, we don't have that much candy, so let's go with Great. You would be shocked, I mean, the things that people, we think we know, and then we just don't. So this is good. All right, here's one. It's multiple choice, okay? You guys are ready? The name of a secure facility for those needing 24-hour monitored care related to dementia and various illnesses. A, memory care. B, assisted living. C, retirement community. D, senior care.
Memory care.
Yes, that's correct. Awesome, this is good. Okay,
Can you read that question and answer again?
say it again.
Can you read the question and answer?
Yes, so that question was the name of a secure facility for those needing 24-hour monitored care related to dementia or various illnesses. And the answers were either A, memory care, B, assisted living, C, retirement community, and D, senior care. And I asked that question, and you got it right, memory care, because so many people conflate assisted living, nursing home, senior care, and they don't really know which is which. Even though memory care is kind of, the name says it, in the general public, people that are going through this really don't know. They just don't know, and so they become overwhelmed. Okay, last question. Multiple choice. What age group represents the fastest growing rate of caregivers? Any kind of caregiver. All right? 1, seniors between 60 to 70. 2, elderly over 80. 3, millennials. 4, high school students.
A.
Who said A? Wow. Wrong. Let's get another guess. I'll give the answers again. A or 1 was seniors between 60 to 70. 2 is elderly over 80. 3, millennials. 4, high school students.
I would say millennials.
That's it. Millennials represent the fastest growing age group that are now becoming caregivers. It's shocking, but it's very true. And this is the reason why we're going to have this conversation today, because there are so many different things that we need to understand about dementia, about Alzheimer's, and quite frankly, the impact that it's having on our communities, the impact that it's having on our lives, healthcare systems, all of that. So here are a few myths. Alzheimer's disease and dementia are the same thing. You said it best. Tell me your name. Clint said it best. Here's another myth. There is nothing that can be done for a person with Alzheimer's disease diagnosis. That is a very general statement and not true. You can actually extend someone's quality of life that has Alzheimer's. I'm a living testimony to that with my own mother. Myth, early Alzheimer's disease is the same as early onset Alzheimer's disease. There's a slight difference. And another one, Alzheimer's disease symptoms progress quickly and are very obvious. In some cases where there's an earlier onset of Alzheimer's, it does progress more quickly, but in general, Alzheimer's is a very long process. I've been in it for 9 years. My mother was 80 when I saw her first symptom, and she's 89 now. So that just gives you an idea. When we die, no one will discuss how much money we made or the level of success we've experienced. People will only remember the impact you made in their lives. And this is very important to note because it kind of speaks to how we see aging in this community, how we may diminish it. We don't think of ourselves as aging, so we just don't really process that. But at the end of the day, what's most important is the impact that we make on people's lives. And we can't really diminish that as people age. They have so much wisdom and so much to offer us that we have to bring value to people as we age. And so just want to highlight that. This is my mom. And in 2010, it became part of our story. It's not the whole story, it's just part of our story. And it was as simple as this. My mom came to visit for Thanksgiving. I was living in Charlotte, North Carolina at the time. We had our own ritual of making New Orleans Creole style gumbo. We did this every season, all the time. And when she would unpack all the seafood that we couldn't get in Charlotte and seasonings and all of this fun stuff, she went to unpack a piece of foil, and she looked at inside the foil and didn't know what it was. And it was a bay leaf. And my mom knows her way around a kitchen, and she knows what bay leaf is. It happened in seconds. She looked at it and didn't know what it was. And just as quickly as it happened, it was gone. And that was my first early indicator that something was wrong with my mom. And then nothing dramatic happened right after that. So that is how simple and how in tune we need to be about knowing signs and symptoms for something like Alzheimer's. Or in our case, my mom was diagnosed with mild cognitive impairment. And that happened 4 years after that event, which is a whole nother story. So does that make sense to you guys? Okay. Alzheimer's is now the 6th leading cause of death in this country. Did you guys know that? What would you have guessed that it might be? Would you have thought maybe not in the top 10? Like maybe in the bottom part? Well, it's now the 6th leading cause of death, and in the state of Louisiana, it's 3rd. Today, more than 5 million people are living with Alzheimer's. And notice I said living with Alzheimer's. So people are living with this disease. Women are living longer, people are living longer, and therefore we're seeing more of Alzheimer's disease. Back in the day, you know, you might hear people say, oh, a little senility setting in, or, you know, our grandparents and our great-grandparents. So Alzheimer's is not new, but it's growing at the fastest rate of any other disease, and it is the most underfunded, okay? Killing more people than breast cancer and prostate cancer combined. So we have a lot of attention on breast cancer. My mom is a breast cancer survivor. But now we're hearing more about Alzheimer's. But these numbers are just very sobering to know the truth about it, right? To know this is where we are. And we need more help. We have no cure at this point, but 4 years ago, we couldn't talk prevention, but now we can actually say the word prevention, and we can talk about lowering risk factors, which we'll touch on. By 2050, 11 million more people could be on this journey. 11 million more people. That's a lot, right? I mean, that's crazy. So, I mean, here are just some numbers for you to see. 53 million caregivers in this country. And that's 53 million people caring for another person, not just with Alzheimer's, but in any capacity. So caregiving is something that's also becoming, it is about to hit a mark where if we don't make preparations for aging, for becoming caregivers, for caring for people that we love, then it will hit us, and it's going to hit the support systems that we're lacking in our communities very hard. Because we have baby boomers that are about to hit age of potentially getting Alzheimer's or just aging issues. And then now children and other people are going to be forced to make these really tough decisions. So it's something we can actually talk about and prepare for. And then 15 million of the 53 million people are providing unpaid care to someone with Alzheimer's. And this is really key because with Alzheimer's, it's different being a caregiver, because when you're dealing with cognitive issues, your mind, your judgment, it's a little different than someone just physically needing help or someone going through a short season of needing help. And so that puts an incredible burden on systems. It puts an incredible burden on caregivers because caregivers have to be present with the person because of those issues. So if you think about where this is going in the long term, this is why Alzheimer's and dementias are very important for us to talk about when we talk about aging. And we don't need to be afraid of it. We need to know more about it, right? So in Louisiana, I just want to highlight that the number of people age 65 and older with Alzheimer's by that age, I mean, just look at the stats. I mean, 2016, I mean, just look at the numbers. 2025, I mean, you can see the numbers. So it's very important that even within the state that we have people like Hannah, and we have universities and organizations and hospital systems and churches and community leaders that are really focused on this escalating number that's happening with Alzheimer's statistics within our own community. Any questions? Okay. We'll have a few minutes at the end for you guys. If you have a question and something that's, you know, really pressing upon you, jot it down and then we'll cover it at the very end. And just looking at the cost for caring for someone with Alzheimer's, the most expensive disease to try and be a caregiver for. I just got numbers through Maria Shriver's Women's Alzheimer's Movement. And the number now is it costs the average caregiver caring for someone with Alzheimer's $230,000 a year. And this is not like exceptional, mind-blowing care. This is the basic number over the lifetime of someone that has Alzheimer's, or over the duration of that person's life. So,
Can you repeat that number that you said?
say it again.
The annual cost?
$230,000 a year. And you can actually find that. Maria Shriver has her own Alzheimer's movement, the women's Alzheimer's movement. And if you went to her website, you can actually see the most updated numbers of what it's costing, probably on Alzheimer's Association as well. So, unpaid care is an important thing that we should talk about, because remember, we have more millennials now becoming caregivers. So that would include millennials also caring for someone in their family, someone that they know with Alzheimer's or a form of dementia. And when you start looking, it's hard for someone that's caring for someone in this situation to be able to work because of the cognitive needs of that person, because of the challenges with mood, because of the challenges of memory and connecting with people. People would always say to me, well, why don't you just get someone else to sit with your mom? We did that, it didn't work. So it has to be me, and then it has to be me working towards the right someone that can come in. Now, my mom can still do some things independently. She's progressed, she's still my mom, but it's still a very delicate process that I have to manage. So it's not as simple for an Alzheimer's caregiver. And then again, just a few more numbers for you to see, the population of people with caregiving support. We talk about millennials now, but we have Alzheimer's is affecting more women than it is men. But at the same time, there are also more caregivers that tend to be women than men. So, these are just important numbers for you to see in terms of age. We have many people caring for their spouses that are aging. It's just really across the board. So we need to be more aware, right? And so we also have informal caregivers like myself, someone that this is just my loved one that I'm caring for, and then we have professional caregivers. These are people that, like your people in memory care centers, you have your people in places like Home Instead and professional caregiving organizations that they disperse people that you can interview and bring into your home for various different reasons. Those are your formal caregivers. So Alzheimer's caregivers, healthcare professionals, faith communities stand at the epicenter of impacting quality of life. So, and I mentioned faith communities because in faith communities we have everyone. And so regardless of your faith, your denomination, whatever, within that faith community are nurses and people and moms and dads and everyone that's facing this kind of epidemic. And so we need to have everyone equipped. We need to have hospital systems equipped. I cannot tell you, having worked in hospitals, having worked in surgery for 20 years, how many people within the healthcare profession really need more education about not only just Alzheimer's, quite frankly, and people dealing with Alzheimer's can tell you how little sometimes our healthcare professionals really know about this disease, but also how to identify when caregivers are in need. So they could be in trouble, they could be in need, they could need more support, and we have gaps in this area. So we've talked about it. One of the fastest growing rates of caregivers are millennials. And these are two young girls that I visited a teaching institution in Alabama and sat in with a good friend of mine. His name is Dr. Danny Potts. He's a neurologist that cared for his father who had Alzheimer's, who's since passed away. And he has a whole story. He spoke at our summit. I'll be going there to speak again in April. But I had the chance to meet with some of his students where he brings art to life and talks about Alzheimer's and the change on his life. And these are some of his own students. And these two girls, these two amazing girls, grew up in a home where their parents cared for someone with Alzheimer's. And I cannot tell you the impact they had on me, the compassion that these girls have, their involvement in the caregiving process. It truly impacts life in a positive way. But these girls are going to go on to create such a great domino effect in life. And I don't know what they're called to do, But they're two examples of millennials that have been greatly affected by this disease, and now it's changed the trajectory of their life. So it just makes it real for you to see. So what is dementia? Dementia is, just so you can see, the loss of cognitive function serious enough to interfere with your everyday life. So people come to me all the time and they say, oh, I'm forgetting things. Do you think I have dementia? No, it doesn't work that way. We all have some loss of memory and things like that as we get older. There are ways we can stay sharp, but when dementia or a form of dementia comes into play, it's when it affects your everyday living. That's what the focus really needs to be on. And then causes and changes in memory, language, thought. These are just some of the areas that you guys can see that would be affected by someone that has a form of dementia. So let's just touch on really quickly the types of dementia. There are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, actually 11 types of dementia. Okay, so I just wanted you guys to see a visual for this because I have so many people that will say to me, my mom doesn't really have Alzheimer's, she has dementia. And that was the reason why I asked that first question. It's just very important as healthcare professionals, whatever care professional we are or will be, even if we're an informal caregiver. Informal caregivers, not speaking of myself, but we rock because we go in and, no, seriously, we go in and we know way more than what many of our healthcare professionals do, but it's kind of just the call of the job. You just have to. But knowing that there are 11 different types of dementia is very important. And here's what I'm going to tell you why. It's very important because the symptoms of various types of dementia can mimic other things. And people will jump to the conclusion and run in fear thinking that it may be an Alzheimer's, which is one form of dementia, but it could be something else that mimics the symptoms. So one of the reasons why we can't be afraid of it is because now we actually know that early detection, which I knew when my mom was 80, that early detection mattered. Just instinctively I knew. But it matters. It matters because people are living long with this disease. And if it's not this disease, it could be something that you could have intervened with. And so very important to be able to know what some of the mimicking symptoms could be so that we don't just jump to the worst conclusion possible. And there are just a couple that I want to talk about. So mild cognitive impairment, for example, 4 years after I saw that bay leaf incident with my mom, I jumped on it like only a Merck Ethicon person would, but it was very difficult. My mom did not live with me. I was in Charlotte, she was in New Orleans. Everything I tried to do, she was pushing me away. That is an indicator. Pushing me away. It was a very difficult time. So I was doing a lot behind her back. So the first thing I would say to people, it's very important now before anything becomes an issue that you have a conversation about power of attorney. Very, very important. Power of attorney doesn't have to be used unless you need it. So just because you have it in place, the conversation you're having with your loved one is not that I'm about to take over, but we need to put measures in place so that if anything ever happens, we can do this thing together and I can help you do this together as opposed to I'm getting ready to take over all of your finances and that's not how it needs to go, okay? So I say that because I'm doing power of attorney right now with my cousin because if something happens to me, he needs to be able to pull the trigger and he needs to be able to step in and help with my mother. So very important. That's the first thing that I would say to you. The other thing is that the earlier the better. Even 4 years after the bay leaf incident, it was still a diagnosis of mild cognitive impairment for my mother. We could see certain things on an x-ray and a brain scan, but I need you to understand that knowing for sure that it's Alzheimer's is a process that is very difficult to actually make. We're not there yet. It has to be identified on a PET scan, and most insurance companies will not cover PET scans. But there are ways to reduce and to deduce that what you're looking at is cognitive impairment or more of an advanced stage of Alzheimer's, or tests that can show you whether or not you're dealing with something like frontal lobe dementia, which through a Parkinson's submission, you can determine frontal lobe dementia decisively. So if you determine that something is frontal lobe dementia, then you can deduce it's not Alzheimer's, right? So the reason why I put this one up is because the symptoms are very similar to an advanced stage Alzheimer's, but the person, it's usually those situations where you see someone more aggressive, very difficult to manage, perhaps a danger to themselves, very high levels of hallucinating, and like I said, frontal lobe dementia can be officially diagnosed, right? And insurance companies will pay for it if the physician does it, the neurologist does it the right way. A screening is not an official way to diagnose Alzheimer's. A screening is when you're filling out the form and matching the pictures and all of it's a screening. We did that twice. A person can pass the screening and do fairly decent on a screening and still be in cognitive impairment and in a cognitive decline that needs to be determined. So brain x-ray, you want to rule out vascular dementia because with vascular dementia, it's from strokes. So if you have your screening, then you follow it up with brain scans and x-rays, you will know that in fact you have a situation where you've had strokes because you can see those on an x-ray. So just, does that help you guys just to kind of understand processing? Okay, signs and symptoms. We're almost to the end actually. So signs and symptoms. This was where my ability to be quite intuitive about my mom really played a role in me knowing something was going on early on. So this is in 2010 when the baby leaf incident happened. My mom looks perfectly fine. She's holding Siva, she looks great. That incident happened like in 2 seconds and it was gone, and this is my mom. So it kind of makes it real for you that we have to really be connected to the people that we love. Like really connected. If you know and feel something's not right, it doesn't mean you take over, but it means you take notice. Like don't just ignore it. So things like mood changes, isolating himself. This is something that my mom was starting to isolate herself in New Orleans, but I didn't know about it. When we would talk on the phone, she sounded perfect because they developed an ability to hide it so well. But this is just an idea of things that you really need to pay attention to. Eating patterns. Are they using the stove? Are they things that they used to do? You want to pay attention to those things. And you don't just need to spot pay attention to it, you need to pay attention to it over a period of time. So it means that we have to be invested in the people that we love, just like we would want someone to be invested in us. Okay? My mom was still driving. She was still going to see her sister, who was in a home for advanced stage Alzheimer's. She was still going on a plane, coming to see me. She was still my mom. She was going on outings, but things were happening that were difficult for me to see at a distance. Just want to share a little piece of this.
Can we do to reduce the risk of Alzheimer's disease or hopefully prevent it? So there are two main lifestyle modifications that have actually been shown to help reduce the development of symptoms of Alzheimer's disease or slow down the progression of existing symptoms. And those two are not surprising. They're things that we recommend frequently as doctors, which are physical exercise and healthy diet. So for exercise, we've seen that aerobic exercise in particular is helpful either preventing or slowing the progression of existing cognitive symptoms. And in particular, we've seen that if you exercise at least 30 minutes at a time, at least 3 to 4 times a week, that can be helpful as opposed to either not exercising at all or even doing stretching or other not as active forms of exercise. In terms of diet, we've seen that a Mediterranean style diet as a whole is the type of diet that is associated with better outcomes. So that diet consists of eating more fish, less red meat, some chicken, a lot of fruit and vegetables, olive oil, nuts, complex grains. Again, it's the diet as a whole as opposed to the individual ingredients, because some of these individual ingredients have been tested and not necessarily shown benefit, whereas the whole diet has shown benefit in terms of reducing the risk of developing Alzheimer's disease symptoms, and also some similar diets that are modifications of the Mediterranean diet. So another important area to target is controlling cardiovascular risk factors.
This is a candy question. So, what's good for the blank is good for the brain.
Heart.
That's it. What's good for the heart is good for the brain. Very, very important to note, because remember, these are not, this whole issue of Alzheimer's now, it's not about like a hit or miss, do something one time. The studies are bearing out now, which we did our summit in 2018. We had a number of really, really great speakers there. But these are really lifestyle changes that are now being connected to clinical studies, because we don't have a cure. Now, I believe we will have a cure one day, but in the meantime, people can't walk around in fear without being empowered to know what they can do to lower their risk factors for Alzheimer's. It's very scary. So, an example of what the doctor from Brigham was saying, when I started doing research, I immediately started on like a real heavy round of supplement therapy for my mom. I increased her vitamin D, B12, and there are a number of others that I researched that I put in her diet. I was already organic and a pescatarian. I want her to have her meat and live her life in her 80s, but I became very rigorous around her diet, and she ended up having osteoporotic episodes in the beginning when I first came home, several breaks. All of that interfered and advanced her short-term memory loss. But when it steadied out is when my mom's quality of life began to steady. And so I'm sharing all of this to say we have studies now to support a reversal in dementia of people with various types of dementia at different stages of dementia. One of the studies is out of UCLA. And so we need more studies, but now the studies are bearing out that exercise, certain kinds of diet, very specific types of exercise can lower risk factors and prevent the disease. So, I'm going to leave it there, but just very important for me to provide hope for you guys in understanding that we've come a long way. So we want to erase the stigma. We want to empower our communities to know more. We don't want to be afraid to know more, because now you know that the more you know, the quicker you can intervene, the better quality of life. And it's never too early to start. If we have millennial caregivers, then we need to be in our 20s and 30s actually being cognizant. And only a very small percentage of people have the genetic disposition for Alzheimer's. So just like with breast cancer, the numbers are not really as high as we think. It's not a link necessarily. I think the numbers are 30% with breast cancer, or maybe a little bit more, that if their parent or someone had breast cancer, that they may increase their risk of having it. But with Alzheimer's, the numbers are like 2 or 3%. So I hear a lot of people say, oh, my mom had it, so will I have it? Well, first, what age did your mom get it? Because Alzheimer's or dementia related to aging is very different than early onset Alzheimer's. So my point is, I saw my mom's first sign at 80. She's 89 now. I think living to be 90 and 90 plus years old is a good quality of life, especially when you have things in place and people that love you and will help you to have that. She could not live without me anymore, but she's still living, right? And this is my mom and I right now. I mean, this was just last year. We go out to dinner every Saturday. I take her someplace new every Saturday. That's actually intentional social skills, getting out, being out with everyone. I take her to work out now with a physical therapist. I call it our workout session. We do that every week. And it's hard. It's hard for me because I lose pieces of my mom all the time. But you learn how to appreciate what you have right now. And believe me, it's not just my prayer life. It's a big part of it. but it's also the knowledge and the importance of me learning the balance of the information and what can I do to make my life better, to make her life better, to make us better. And that's a really important message for you guys at this stage of your careers and what you're moving towards. Now, just a couple of ways that you guys can, Hannah mentioned that my organization's name is Heal 3D. We have our summit coming up November 6th and 7th of 2020. And it's going to be fresh and new. We're going to be talking about things like the role of hormones when it comes to Alzheimer's and other diseases. I mean, it's like really going to be fresh. We're going to talk about some of the basics. We're going to talk about new things. And then, so you can support that way, and I'll keep Hannah involved. We have student rates for everyone to come for the full conference, everything included for students. And then the other way is just a short story, and then we'll do questions. My mom is an artist, and my mom was an art teacher, and she's an artist. And when Hurricane Katrina happened, we know that life changed for all of us that were involved with Hurricane Katrina. We lost everything. My mom lived with me in Charlotte for 3 years. While we were there, my mom created jewelry. She would design jewelry. Her dream was to go to New York, but those opportunities didn't exist for her then. And one day, my mom and I got together and when we were in Charlotte, and we wanted to do this jewelry line. And we tried everything. She did sketches. We did sketches together. And we tried everything, and nothing would happen. We couldn't get anyone to part. I mean, it just didn't go. But how many of you can understand the right vision at the wrong time? Right. Never knowing Alzheimer's would touch our life. Like, never having a clue. So then I come home, and I forgot about it. You know, it's like 8 years later, I forgot about it. And one day I was praying, truth be told, I was praying, and I was reminded that we had jewelry sketches. And I was like, the jewelry line, whatever happened to that? Mm-hmm. Where in the world am I going to find those sketches? Because I had moved. I left everything behind. I sold my house. I sold land. I sold everything I had except for 6 pieces of furniture and all my clothes. That's all I kept when I came home. And out of nowhere, I go in my mom's closet. I was getting her clothes out, and a folder drops to the ground, and it was the jewelry sketches. Wow. Pages and pages of jewelry sketches. So I grabbed the sketches, and I pulled them out, and I set them on my desk, and I went, there's no way in the world I don't even know what God could be saying to me right now, but I'm just going to set this here. There's no room in my life for me to I wouldn't even know where to start. And then one day I said, Oakland Heart Jewelers. My daddy and I used to go to Oakland Heart Jewelers to buy jewelry for my mom. I'm just going to use my skills and go in and pitch it, and maybe they'll partner with me. So I pulled my stuff together, brought my sketches, went in, and lo and behold, we have a jewelry line. And Oakland Heart partnered with me on that jewelry line, and they're still partners of mine. We did our first collection, and I'm just very pleased about that. We worked very closely on it. It's the first one. Others are to come. But that's another way that people can support us, because a percent of the proceeds for the jewelry line go to support caregiver progress and health, and then Alzheimer's education. So that's another way that you can support it. But deeper than that, it's part of our story. And it's part of how you can turn one thing that's negative and how it can be used to become something that can change lives and help people and help you at the same time. And so this is just a few images of some of the pictures of our jewelry line, and they're all at Oakland Heart, and you could always see them there. And just to know more about Heal 3D, there's 2 things that we focus on: progressing caregiver health, spirit, soul, and body. And we do that oftentimes through retreats and restorative type programs where caregivers get a respite and an opportunity to socialize, to receive kind of the support systems that they need psychologically, emotionally, relationally. And then the other is through the Alzheimer's Triple E Summit, which is coming up in November. And these are our priorities, and that's the information on the summit. And this is just a sample. So now we can open for questions. How much time do we have? A few minutes for questions?
About 13 minutes.
Okay, that's good. So I'm going to open it for questions, anything at all that get me while you have me. I would love to be able to answer them if I can, yes.
What stage is your mom in now?
My mom, I would say that she's in a moderate state. Like if there is mild, like she's progressed from where we were at the mild stage. She's more moderate. She does not have any hallucinations and all of that. She can dress herself. She takes her own bath, but everything up to what she can do, I'm involved in making it happen. So my work is never done. She doesn't drive, obviously, anymore. That hasn't been for a long time, but she's doing very well. Otherwise, you would see my mom, she would make you laugh, you would have a conversation, and if the conversation went longer than a few minutes, you would see it circle around, repeating, but otherwise, she laughs, she would interact with you, she's social, she's good, but it wouldn't have been, when I came home, it wasn't that way. She was going down, and she was going down fast. So it just shows that it can make a difference. Yes.
Do you see, I have, my grandmother has Alzheimer's. My mom is her main caretaker, but unfortunately my grandmother lives about an hour and a half away, so
Yeah.
my mom goes up and once a week to help her out. But she's in an assisted living facility and.
A memory care unit of that assisted living, or no? She's,
Yeah, in the memory
okay.
unit. And my mom is having a lot of trouble finding people that her mom won't reject
Yep.
immediately. Do you have any strategies for coping with that?
So she's in the memory care facility. And the people in there she's rejecting.
Yeah, like with my mom has tried several occasions. She's tried different people that she says, okay, mom, somebody's going to come and visit you tomorrow. Maybe take you out to lunch, help you, cook a meal or something. She has people that she sends to go visit with her for a little bit of socializing and to help her out. But every person that she has sent in, her mom, my grandmother, has just kind of not wanted to be
Right.
part of.
So yes and no. So it may be a little more challenging when in the memory care centers, but this is what it comes down to. It's not an easy answer, but it is the answer that I know that works. We don't work well when we're in insecure situations and we don't have relationships. And so the best that can happen in that situation to make it better is for your mom or someone to take the time to find a person that she likes that can then build a relationship and trust with her mother.
Right,
And I'm not saying that it takes a long time, but I'm saying it takes the effort.
right.
And through the relationship and her feeling a sense, because she can still feel, she just can't communicate the way we do a whole nother talk on communicating with someone that has a form of dementia or Alzheimer's. We have to understand that it's not as much about communicating, but connecting, because their ability to communicate changes. So building trust and finding someone that she can build a trust and a relationship with that doesn't want her to do anything at first, just wants to hang out, talk to her, be with her. And I have found, because I have someone I finally found with my mom, and I found that person through my church, but I had other people in my church that didn't work out. But I policed that, and I was very discerning about, this is not going to work. If it doesn't work for me, it's not going to work for her. And then I found someone, and now my mom sees that person on a regular basis, so it's all not necessarily to care for her, but just coming to the house, hanging out with me.
So not even necessarily somebody who's in the facility.
Not necessarily.
From outside churches, I think, probably.
And that could be an option, but what I'm saying is your mom probably has to do the due diligence of finding that person that she likes and connects with, and then bringing that person to connect with her mother, and then consistency and slowness to push anything. It's just, you kind of think of that person, if that person is 80 with dementia or whatever the age, you kind of have to backtrack, like, okay, if they were 5, then what would it be like? Your 5-year-old is not going to just necessarily stay with anyone unless they feel comfortable, and you wouldn't want them to. So in the memory care unit, it's harder because they have assigned people that are doing that. Well, that's a whole nother talk, to be honest. Yes and yes. I'm sorry, yeah.
We have a friend who's been diagnosed with mild cognitive decline. She lives alone.
Yeah.
She has a cousin and her husband nearby, but her daughters live out of state.
Like me, that's how.
Yeah,
Yeah.
so I'm just curious, how, as someone kind of on a periphery, how do we help her? She's still driving, she's still doing things. I worry about her. I just don't know how to help her not being a family member.
So when we finally, 4 years later, got an official diagnosis of cognitive impairment, along with that, and we had a really great neurologist, because I left a bunch, just so y'all know. I mean, I'm not the one. I mean, yes, I'm scrutinizing because of my background in medicine, but I will leave somebody. If I don't like it, I'm out. But this particular neurologist, who really doesn't have a high Alzheimer's patient population, I liked him. And he did all the right things. He said right up front, she can't be alone. And that was with a mild cognitive impairment diagnosis. Now, I wasn't exactly here, but when he said it, then I had to make some decisions. So it doesn't mean you have to take over, because even when I came home, she was still driving and all of that. But I had to be more aware and I had to be more present. So I would say not necessarily about getting someone to come in, but having a family meeting and really facing and having some tough conversations about what does this mean, what can mom do, what do we feel a little shaky about her doing, someone able to really be connected to her daily activity to see if anything is falling in between the cracks, paying bills. That was happening for my mom. Things that you wouldn't ordinarily see. And you just kind of assess the situation. You don't need to change anything, but assess it. And then when you assess it over a month, then you kind of determine, well, maybe we can get someone, one of the sisters or somebody to check on her this many times a week, or you just develop a game plan. And so you're right to be concerned, but not so concerned that you start taking things away, right? You know what I mean? So I think I just share it with someone, it's time to huddle. It's time to really sit down and let's talk about this and what this looks like. And definitely that power of attorney. Like that power of attorney, I cannot tell you with cognitive impairment, if you wait and then they start getting paranoid, you're done. So right now, and even really before that, but right now while she can still communicate and all that, it's having a conversation. Not we're going to take anything away, but hey mom, I decided I was going to do a power of attorney for me. And, we were thinking, can we have a conversation about that? Like, I'm doing it for me, sister so-and-so is doing it for her. We're doing it for our family. Can we talk about what that would look like for us? That's really important, because it doesn't matter what happens. If somebody doesn't have power of attorney, she's going to have all the control, and that's not going to go well.
Right.
Okay, yes. So, all right, so we have, I'm sorry, yes.
How early can you get early onset dementia?
Say it again.
How early can you experience symptoms of early onset dementia?
The earliest reported case right now of Alzheimer's is 28 years old. That's the earliest reported case of Alzheimer's.
Okay.
So wait, we're gonna do a giveaway, and then I have 3 books, and so we're gonna just pull numbers, and then you can choose whichever book you want. And then I also have some giveaways on how to navigate living with someone with Alzheimer's. They're all free. All right. So all right, here we go. Okay, first number 11. Who has 11? 4. Who has 4? Okay, somebody left. 2. There you go. Go choose your book. I'm mixing them up. 17. Good. No, one wasn't there. I had 4. That was okay. It's what? 21.
Oh my
Thank you guys so much. I have my cards. All those the little booklets over there. Please feel free to take one. Winners, go get whatever book you want. And thank you so much. Thank you.
Thank you.